So I think when you've got a situation where the family setup dynamic is not ideally positioned to be vigilant and to provide input on their child's care in the hospital, I do think that the inpatient providers have to step up their game a bit on double and triple checking what they're doing. I mean, not to undermine the standard level of work that's happening, but I mean, taking time out to review the med list every day outside of rounds, doing more of a chart biopsy, like we call it, and going back through the chart and looking at all the durable medical equipment that's used, and learning as much as you can about the child and making sure that you're administering things correctly. If there is home nursing involved or other community outpatient providers, getting in touch with them. This is what we're doing. Does this sound right? Are we missing anything? Just not being satisfied that you've got it all down, and keep trying to gather more information that you can to make sure that you're not missing anything. The process for doing that is not well scripted, but if you've got that fire in your belly of thinking, maybe I don't have it all down, I need to keep checking and making sure that it's right, it may lead to you discovering something that makes a change.
I also think tapping into the other resources in the hospital is incredibly important for people that may need extra support, whether it's language, cultural, making sure it's really a hard issue with interpreter services. Often they can be called when a consultant comes in or a specialist comes in to communicate important medical information, but what happens with the relationship between the patient and the nurse when it's simple communication that has to happen and there's not an interpreter there and they speak no English. So tapping into interpretive services as much as possible. Also chaplaincy, the chaplains often have a lot of cultural awareness about them, and that they can be very supportive for families, and families that are having difficulty with just team interaction because of those barriers. They may be able to help allow them to be more expressive about maybe concerns or worries that they have. We also, have child life services if there's issues going on for the child that maybe the family's not experiencing. So I think in those circumstances, it's really important, the PAC team, social work, to just tap into every consultation service that you can.